Welcome, I'm Lauren Collins.
And I am Elena Umland. We are the co-directors for the Jefferson Center for Interprofessional Practice and Education, also known as JCIPE.
Thank you for watching this video to learn more about JCIPE as we celebrate our 10th anniversary. Over the past 10 years and counting, JCIPE has achieved a number of milestones.
Some of these milestones include growth in our IPE programming for our learners from one program in 2007 to 13 distinct programs in 2017.
We have had the privilege to work with over 7,000 students and faculty and to engage in scholarly efforts to advance the field, including publishing more than 200 manuscripts, delivering more than 275 peer-reviewed presentations, and over 100 invited presentations and consultations.
We hope you enjoy this video and learning more about JCIPE and the people who have helped to make it a national success: the administrators, faculty, staff, community members, patients, and students.
What I most want people to know about JCIPE is the collaborative effort that we have. We work so closely with so many faculty and staff members to make the kinds of programming and research and faculty development possible. And it really takes that kind of effort across the health professions, across ages and levels and roles at the university to make our work possible.
People that are involved in JCIPE, the professionals, are so energetic. They all are committed to the mission and the objectives of JCIPE. They truly exhibit all the core competencies of collaboration and teamwork. And it's just really a joy to work together with all professionals.
Interacting at any level possible in the JCIPE curriculum really will change the way you think about other professionals, how you think about patient practice, and how you think about healthcare.
I'd like people to know that JCIPE is a resource for people here at Jefferson, and that it's a very creative and dedicated group of people, and it can help make interprofessional education at Jefferson even better. And there can be ideas in interprofessional education or practice that they can then take beyond what you thought you could do with it.
What is the inter in interprofessional? What is the inter? And I tell you, we don't know. I don't know. I'm trying to understand, but I think asking these kinds of questions, which are aside from, oh, we love it, let's do a lot more of it, which is students will tell you all the time, we like working together, let's do a lot more of it. It's these kinds of questions which will then allow us to understand what the inter piece is, because if we are going to use faculty development and so on and so forth, we have to know what that inter is.
What I would like people to know about JCIPE is how deeply rooted our work has always been in patient-centered care. So really the first big thing we did was the Health Mentors program, and that continues to be our flagship program. And I'm so proud of the fact that we were smart enough, through lots of good advice, from the very beginning to make our patients our teachers.
My favorite memory of JCIPE is actually a letter I received from one of our health mentors. This was back when I was the Health Mentor Program Director, and our health mentor wrote me and said how valuable the experience of being a volunteer teacher to our interprofessional healthcare students had been for her. She felt like she was changing the way we educate our future healthcare professionals, and that she was going to directly impact the type of professionals they would become and the type of care future patients would receive. So she felt that she'd been giving back to future patients like herself who'd been struggling with chronic conditions. So I've kept that note card with me for the last few years, just as a reminder of the purpose of JCIPE and why we're trying to train students to work together on teams.
My favorite memory of JCIPE but more specifically the Health Mentors program, has just been seeing the bonds that the students and the volunteer mentors form. Our mentors have been in the program for years, and they're all amazing because I get to meet and deal with all of them, but the specific student teams get to just form great relationships with their particular mentor over 2 years.
The essence of good care for patients, that many people acknowledge that in their training they know about one part of the body, they know about another part, they know about, but that nobody knows everything. And together they can make a better care and better quality and a better life for the person who's being treated.
Sitting around the table working on the Health Mentors program curriculum very early on, about 10 years ago, and as we were sharing and talking about our professions, having someone from a different profession look at me and say, wow, I really didn't understand or appreciate that that was all that pharmacy was able to do. I thought all they did was count pills and dispense, period. I
was fortunate enough to be in a position to be able to try to help the establishment of JCIPE, and I guess my favorite memory is the follow-up to my meeting with Tom when we agreed to put the resources together to get both Chris Aronson's and Molly Rose's agreement to join this project and to become its leaders during its terribly important formative years.
It takes vision to do this, and there was a lot of vision in starting JCIPE, and that vision is what's allowed it to last for 10 years and what will ensure that it lasts for another 150 or whatever the time is.
What's amazing about JCIPE, what's amazing about people like John and Molly and some of the other people here is, I always talk about we need a revolution in healthcare when it comes to disparities and when it comes to how we select and educate our folks. You guys have done it. You guys are doing it, and I think that's the thing that gets me most excited about JCIPE.
Hotspotting is identifying a patient that may have higher needs than the normal population in the hospital and addressing social determinants of health that may be contributing to that high utilization.
Our goal is to work with that patient to identify barriers and figure out why they're utilizing the ER so much, and then also to encourage and empower them to set their own goals.
This program has really taught us how to work together, learning which disciplines can offer certain skill sets to our goal.
I think hotspotting represents the future of healthcare, less focus on the acute setting, less focus on treatment and specialty care, and more focus on the public's health and the preventative aspect of health and the social determinants.
We spend way too much time talking about how technology is going to disrupt the system. You're going to disrupt the system. Technology is the tail wagging the dog. If anything, we need to become more human.
JCIPE is hugely important to our campus, to our students, to our faculty, and that it should be supported in every way, shape, and form.
The recognition that Jefferson is one of the major leaders in interprofessional education in the United States.
I had a nursing externship over the summer at a very large hospital in the Ohio area, and there were students from huge universities out there, huge universities over here, and a concern that they all had was they had never met with a doctor, never called pharmacy, paged the resident if there was an issue with their patient, and they were very nervous about that. Whereas I had this experience at Jeff, and I was coming in very confident and able and willing to do it and step up. So I felt like Jefferson really prepared me for other experiences just outside of the classroom as well as here at Jefferson.
Hopefully you've seen by watching this video that supporting JCIPE programs truly takes a village of committed stakeholders. We are so proud of the collaborative work that has emanated from JCIPE.
We are so grateful for the time and dedication of our faculty, staff, health mentors, and students who've contributed to the decade-long successes that have been realized.
As we look to the future and consider developing, implementing, and evaluating new IPE and collaborative practice innovations, we thank you for your support and hope that you will continue to join us in this team effort.
Thank you for watching this short video and for your efforts in making teamwork an integral part of Jefferson's new vision for health professions training and delivery.